The fight back against the benefit cuts continues. Rest assured, anyone watching this, please know that there are many organisations around the UK and disability advocates, individual patients too, are fighting as hard as they possibly can to show the realities of the 4-point rule, the fact that that's then going to impact people on universal credit with the health element after the autumn. There's lots of work going on behind the scenes. But I wanted to show why I'm particularly frustrated, because from an ME perspective, I've been warning that increased numbers of people are going to be becoming disabled as a direct result of the pandemic since 2020, but I've submitted official things to inquiries in the last couple of years, and that's what this is going to show. Okay, so 2 seconds. So this is a blog that I wrote in March 2023, and it was about a submission that Stripey Lightbulb CIC had done to the Plan for Jobs and Employment Inquiry. Right, and in this, I'm not going to read it all out, but we were concerned about the economically inactive rhetoric of the Conservatives that's now been continued on into Labour. Nobody is economically inactive. If you're on benefits, you spend those benefits. That money goes back into the economy. You're not economically inactive. Anyway, that's a side issue. Here we go. So in March 2023, the UK government has yet to acknowledge officially that half of long COVID cases meet MECFS diagnostic criteria. Still hasn't been officially acknowledged, but it is being said more widely. And to be clear, there is no diagnostic test for ME. This is based on a diagnostic criteria. If you meet that criteria that includes post-exertional malaise, then you are given an ME diagnosis. But even then, ME is both over and under diagnosed. So we have absolutely no idea how many people have ME, but we have like a rough idea. You can work out an estimate. And at the moment, many different organisations estimate that the current prevalence of ME in 2025 is 1.25 million. It's 4 times bigger than it was at the start of COVID. So with that in mind, this submission that we did to this inquiry says there are at least, back then in 2023, at least 5 international research studies that have stated that half of long COVID cases meet the diagnostic criteria for ME. So there may not have been research in the UK as to what the prevalence is now or what the economic impact is. It hasn't been updated since 2017. But there has been research done in the US, and that was mentioned in this inquiry submission. So that research study says, prior to the COVID pandemic, we estimated a United States MECFS prevalence of 1.5 million and an annual economic impact of 36 to 51 billion. Now, due to COVID and its resulting post-acute sequelae, we estimate total MECFS prevalence could rise to between 5 and 9 million. This would incur an annual US economic impact of 149 to 362 billion in medical expenses and lost income, exclusive of other costs such as disability benefits, social security, social services, and lost wages of caretakers. So as I said in the submission, this will be replicated in the UK, though there is currently no specific UK research available. But we estimate that the pre-COVID estimate of 260,000 has now increased 4-fold. And what I wanted to stress to the government is that it was scientifically known that only 25% of people living with ME are physically able to be in employment. Okay, and some of those could only work part-time and with flexible working hours. Okay, and we knew that only around 5% ever fully recover from ME. So of all these people that are getting COVID, even very mild infections, the likelihood was that they had only a 25% chance of staying in employment. Does that make sense? So the NICE guideline says that people with ME struggle to work. This is all in this submission, which is in a blog on our website, stripylightbulb.com. At the bottom, please note, the UK government is not collecting data relating to the number of ME/CFS cases triggered by COVID. And so central government data on the prevalence of ME/CFS and the impact on the UK economy, jobs and employment is unavailable. 2 years later, that data is still unavailable because they're still going by the 250,000 prevalence estimate, despite the fact that at least one of our national charities now uses 1.3 million as their estimate in the UK. But that was from last year. And when you consider that COVID is still around, every other virus is still here, and all the other triggers of ME, our cases will have gone up. Slowly, but steadily. Still, we're probably at 1.4 or 1.5 million now. So I get incredibly annoyed when I see politicians saying these people just need to get back to work. They're only off work because of lockdowns. They've all got anxiety or mental health issues. Now, a lot of people watching this video won't know this. An awful lot of people that are at the very beginning of having ME, because there's no biological test, a GP will have done lots of tests, and then more often, and they all come back normal. It doesn't mean there's nothing wrong. It just means there is no valid test to test for ME. Anyway, a lot of these GPs are telling patients that they have anxiety and that all they need to do is go back to work and start living life and, get back to normal. It's just because it's been really stressful for the past 5 years. You'll be fine. So these people are going back to work, and because they're pushing through, they're making themselves sicker, and then they're having to leave employment. I've even heard cases of a GP saying, I think you've got ME, but there's such a huge stigma surrounding ME, I don't want to give you that diagnosis. I'm going to put anxiety on your medical record, which is actually against the law because you have to keep accurate medical records. That person doesn't have anxiety. They might have now because of how the healthcare profession is treating them, but no, they've got ME. So when I hear the press saying, oh my God, millions more people have got mental health issues, it's like, I don't doubt, I've said this before, I don't doubt that cases of mental health issues has gone up. But I don't believe it's gone up as much as is being stated, because I do believe that ME and long COVID is being recorded as anxiety or other mental health issues. And that doesn't do anybody any favours. It means that the person with ME or has long COVID and post-exertional malaise can't do self-care appropriately. They don't know that they're not supposed to be exercising. They don't know that they're supposed to be living within their energy envelope. And that makes the chance that they can stay in employment very reduced. And it's also a fact that the PIP assessment form is not appropriate for energy impaired illnesses, which is why I'm now working with a focus group on creating what one of those forms should actually look like. Nothing the government is doing at the moment is informed. They're not making informed decisions about how many people they're going to be able to get back to work, because they don't know why those people are off work in the first place, especially if it's been logged as a mental health issue. If that person thinks they've got anxiety, they don't know they've got ME. All these kinds of things. It's really complicated, but I keep hearing the government say, we're pushing forward with welfare reform because the welfare system needs to be reformed. I 100% agree, but the way they're doing it is wrong, because it seems to be that they've created a welfare system that is as difficult to access as possible, as demeaning and stigmatizing as possible. But now that framework isn't working, they're taking it out on the people that need that money, rather than, okay, doing it the nasty way isn't working. If we actually, because they haven't consulted disability organisations or people with lived experience at all, they've literally picked this 4-point figure from thin air because they've been asked to justify it. And all they've come out with is, oh, well, we had to have a point to work with. It's like, yeah, but There's an awful lot of really sick people or people with like really significant mobility issues that won't meet the 4 points, but they will also not be able to go into work either. So what are you going to do for those people? Yeah, I think the government's making an awful lot of decisions with no data to back it up. And the one that I've read out to you in our submission is just one example. I'm sure most charities or third sector organisations such as Stripey Lightbulb have so many examples of, well, if they'd listened to us and we said that, that wouldn't be happening now. And as for Wes Streeting saying that they're doing prevention now rather than reacting to stuff, now that they know that half of long COVID cases meet ME criteria and that there is no treatment, no cure, no biomedical test for ME, and that only 25 can physically go into employment, what exactly are they doing to curb COVID-19 infections? I'll wait. To the point where on Sky News last week, there was a former chair of an NHS trust on Sky News saying, I have no idea what the UK Health Security Agency thinks they're doing with COVID-19 because it's an airborne virus and they're telling people to wash their hands. So you wash your hands and then have a conversation with a colleague and you're breathing in all of their air from their mouth and they've got COVID. How will washing your hands stop that? Anyway, so I kind of take there's too many disabled people. There's too many people on welfare. It's like, yeah, but you're doing nothing to prevent those people from getting disabled as a direct result of a virus that is very easily mitigated against. Just think the money they save on benefits, you would think they would be putting towards air filtration in public buildings, but they're not. It's far more complicated than let's just get everybody back to work. If you don't have energy, if your mitochondria is broken, you cannot push through and you can't work. My brain literally feels like it's shutting down while I'm doing this video. Like as soon as this is finished, that's it. I won't be able to think straight for a couple of hours. Now, if I was in a place of employment, would I be able to step away and sit and rest for a couple of hours? No. I wouldn't, and I've only got mild ME. I'm one of the 25% who is physically able to work. But anyway, so there you go. So we are very active against these benefit cuts because they don't make sense. They make zero sense. And it's literally someone has just said, right, we need to save this amount of money. We need this amount of people to come off benefits, whether they're entitled to them or not, and we will enforce it regardless of how much pushback we get. But they've not consulted anyone who knows anything about disability or chronic illness. And I think that is appalling. Thank you for listening.